On PrimeTime Politics tonight, COVID vaccination should ramp up as Canada readies to receive 2 million doses a week on a day when an Ontario teen becomes one of the youngest COVID victims in Canada. And Ontario makes a request for help from the military. Opposition MPs push for more committee hearings on the Vance allegations as the circle of government insiders who were told of the allegations widens. And the federal budget, as expected, is passed by the Commons. Snap election averted. Our panel of parliamentary journalists weighs in on that and the ongoing COVID response. And that's where we'll begin with the latest developments on COVID-19 in Canada. We have been hearing how the third wave of COVID, it's been especially hard on younger Canadians. And sadly, another one of those young people has lost her fight against the disease. 13-year-old Emily Victoria Villegas died last Thursday in Brampton, Ontario. Her death announced today. Members of Parliament observed a moment of silence in her memory. With high case numbers and hospitalizations, Ontario is getting help. A small contingent of healthcare specialists from Newfoundland and Labrador will arrive in Toronto on Tuesday. And the federal government has approved a request from Ontario to deploy military medical personnel to help overwhelmed hospital staff.
We have requested some assistance from the federal government to help us with a request to the other provinces and territories, and also to see if they're able to send us any further supports in terms of personnel from either the Canadian Armed Forces or the Red Cross. As you know, we are seeing increasing numbers of people in our intensive care units. And as we are building more beds, we have created more spaces. We have set back and delayed some of the emergency surgeries and procedures, but we are still in need of some more health human resources, although we've extended them considerably.
Dr. Isaac Bogoch is an infectious disease specialist and a member of Ontario's COVID-19 task force. He joins me again today. Dr. Bogoch, good to see you again. Thanks for taking time, as always. Let's begin with the heartbreaking death of this 13-year-old girl in Brampton, Emily Villegas, one of the youngest COVID-19 deaths now in the country, one of the 8 Canadians under the age of 19 to have succumbed to this virus, and quickly, it seems. Younger Canadians are now dying at home before they even make it to the hospital. Why is that happening?
Well, first of all, this is just an awful case. It's tragic, and I read a few different articles sort of outlining the events, and it's just horrific. There's no other way to put it. Certainly we know that the variants of concern can cause more significant illness. We know they spread more quickly. That's probably driving some of it. I think it's also fair to say that as awful as this case is, and as awful as all the deaths are, the risk factors for death are still on the older end of the spectrum. They still are, even with the variants of concern. Yes, we are seeing younger and younger people land in hospital, but if we look at the risk factors for hospitalization and death, we still see, by far more older and people on the older end of the spectrum who are significantly impacted. Doesn't mean bad things can happen to young people. They certainly do, and this is a tragic example of it. But when we're looking at death and other negative impacts, it's overwhelmingly in people over the age of 40.
You are part of Ontario's vaccine task force. There are growing calls now to refocus the vaccinations on essential workers and those hotspot neighborhoods where most of the infection and spread is happening. So far, only about 25% of the vaccines going to those places. But there is talk of expanding and ramping up those doses to those communities. What are your thoughts on that?
I mean, when we were putting together the vaccine rollout plans, the stage 1, stage 2, and stage 3 rollout plans for the province, this is explicitly outlined in the second phase, which we're in right now. I mean, it says it right there that there will be priority vaccination for heavily impacted neighborhoods, including racialized neighborhoods and low-income neighborhoods. It's right there in the framework. So we certainly can work within the framework. And really the debate now is, to what extent, right? How much vaccine? Of all the vaccine we're getting, what proportion of vaccine should go into those neighborhoods? I think there's room to increase that. I really do. And I think it's the right thing to do because we know that about 50% of the infections are in 20% of the neighborhoods. So it's the right thing to do. It's the moral thing to do. It also ends this pandemic faster for everyone. I mean, if we quell that,
right,
it has tremendous spillover effects for the rest of the province.
There's also talk about reallocating. I mean, right now the vaccine is distributed on a sort of per capita basis, province to province, but some provinces are doing better than other provinces. Where are you on the notion that maybe we should start redistributing the vaccine, more vaccine going? Skip the per capita model. Let's send more vaccine to places that need it most.
I mean, listen, there's obviously the science and the public health, and then, of course, there's the politics. And I mean, this would be a very, very challenging conversation to have. Having said that, if you pour the water on where the fire is burning hottest, you're probably going to get the most bang for your buck. But I don't know how you would navigate that on a federal level. There'd be a lot of angry constituents, I think.
Starting this week and for the next 5 weeks, Canada will be receiving at least 2 million doses of vaccine a week. What impact will that volume of vaccine have on curbing the spread?
This is fantastic. So Pfizer is really stepping up, and we're actually doubling the amount of Pfizer that's coming into the country. I mean, it's incredible. It's a great vaccine. It's been able to be distributed very quickly through mass vaccine sites and through other venues. And I really think that the provinces can expand and they can really, continue to vaccinate at a fast pace, but ramp this even up further to just get as many people vaccinated in a shorter period of time. It will take some effort, but hopefully the infrastructure is there to do it.
Canada also begins receiving Johnson & Johnson vaccine this week, the single-dose vaccine, just as supplies of AstraZeneca are drying up for a bit. There have been concerns raised in the U.S. about the J&J vaccine and rare blood clots there. We may be facing some more hesitancy in this country around that vaccine in Canada. What concerns, if any, do you have about the J&J vaccine?
Supply is interesting. Like, we're going to get an initial shipment, but I'm really curious to see how much more we actually get in. And this is a great vaccine. Like, this is a one and done type vaccine. You don't require that same -20 or -80 cold storage that you do from Moderna or Pfizer. Like, this would be a great vaccine to really get in populations that just have barriers through no fault of their own, but in populations that have barriers to vaccination. So, shelter populations, prison populations, migrant farm workers. There's just a lot of really good groups that could have, equitable vaccine access with this when we can't entirely guarantee that we can get them back for a second dose. Obviously, we have to work to reduce those barriers as much as possible, but we also have to be mindful that there are, sad inequities that are going to take time to iron out. And I really think we can do a lot of good with this vaccine in those populations.
There are increasing calls for more testing of essential workers at the border and even tighter border controls as we see stories of Canadians exploiting a loophole in the flight quarantine rules by jumping in a taxi in the U.S. and taking it across the border. Are we doing enough at the border?
I mean, I think the border measures are doing something. Really, they are buffering us. It's not perfect. It's not 100%, but I think it's fair to say that we have buffered ourselves from a lot of COVID-19, including variants from coming into the country with the border measures. But no, it's far from perfect. Listen, we imported B117. That's the variant of concern that was initially discovered in the United Kingdom. We were initially able to count that on one hand, and now it's the dominant strain in many parts of the country. So we are importing it. Even if we import it infrequently, it can still have negative repercussions on the country. I think we also have to factor in any border measurement with an understanding that we are vaccinating and cases are actually starting to come down, plateau and come down. There's always room to tighten things up at the border, though, and there's always room to eliminate those loopholes. And certainly something that the federal government should be looking at.
I'm sure let's finish on this. I'm sure your perspective has changed from week to week as we go through the pandemic in terms of where we are, what we're up against. Tell me what you think as we start this new week. As you look down the road a little bit, what do you see?
Next couple of weeks are going to be tough. There's no question about it, right? Our healthcare system in many provinces is stretched beyond capacity, and it's just going to be a tough few weeks in the hospitals. If you look at the midterm and long-term forecast, I think things look really good. We're vaccinating hundreds and hundreds of thousands of people per day in the country. We've crested in many parts of the country and maybe have even started to come down out of this third wave. Other places, not just yet. So I think the midterm and long-term forecasts look good, but it will certainly be a very challenging few weeks ahead to get through this third wave.
All right, Dr. Isaac Bogoch, thanks again for your time tonight. Appreciate it.
My pleasure.
Well, opposition MPs are pushing for more committee hearings into the allegations of sexual misconduct against former Chief of Defence Staff General Jonathan Vance. The demand comes after the latest testimony suggested the Prime Minister's Chief of Staff, Katie Telford, was aware of the allegations against Vance. That testimony came from Elder Marquez, a former senior advisor to the Prime Minister. He testified he was told by Telford or her assistant to contact the Minister of Defence in March of 2018 about an allegation against Vance. That would appear to contradict the version of events from the Minister of Defence, who told the committee it was his office that reached out to the Privy Council about the allegation, not the other way around. Let's bring in three members of Parliament now to discuss all of this. Anita Vandenbeld is the Parliamentary Secretary to the Minister of Defence. James Bezan is the Defence Critic for the official opposition Conservatives. And Lindsay Mathyssen is the Deputy Whip for the NDP and is a member of the Committee on the Status of Women, which has also been looking into the allegations against General Vance. Anita Vandenbeld, let me start with you. The Prime Minister has said he didn't know about the allegation against General Vance until he heard it in the media. But the latest testimony suggests his Chief of Staff, Katie Telford, was one of the first to hear about it in 2018. Is it reasonable to assume that if his Chief of Staff was aware, the Prime Minister must have been aware as well?
I think that what we've seen is that, and even the clerk of the Privy Council has said that, is that what you had at that time is it was not actionable, and they had reached an impasse. So at that point, there was nothing to actually tell. I think what you're seeing in committee is we have heard from the acting Chief of Defence Staff, the clerk of the Privy Council, the Secretary to the Cabinet, 6 hours with the Minister, and all of it is pointing in the exact same direction, is that the proper processes were followed. It went to the Privy Council, and that in fact everybody. It was Mr. Warnick himself that said everybody.
But are you saying that Katie Telford may have known? It may have been brought to her attention, but she didn't think there was enough there to tell the Prime Minister?
I think that's exactly what Mr. Marquez said, and that's exactly what Mr. Warnick said. It went to the highest public servant in the land. It went to Mr. Warnick, the clerk of the Privy Council, who said that at that point there was an impasse because they did not get a copy of the person who wanted to come forward.
Mr. Bezan, why do you want to question Katie Telford, and what do you want to ask her?
Well, I think it's got to the point now that it's not at all believable that Prime Minister Trudeau didn't know about the sexual misconduct allegations against General Vance. We know from committee work and that Katie Telford was immediately notified by Zita Estravis, the Chief of Staff, to Minister Harjit-Sajjan. And that she took that information and had Elder Marquez contact PCO and go back to Zita Estravis.
But do you think it's impossible to think that they went down the road a little bit, found that they couldn't substantiate the allegation for the reasons they've all talked about, that the Prime Minister would not have been informed at that point because they had nothing to tell him?
As Mr. Warnick said in his testimony, that he's very disappointed that they lost sight of these allegations against General Vance. And that's because this government, even though they talk about being a feminist organization, they actually have done nothing and are a bunch of phony feminists. And so what we have here is that both Minister Sajjan and the Prime Minister knew about these allegations and still decided to extend General Vance's contract for another 3 years, gave him a $50,000 raise, and left him in charge of Operation Honor. And we know that he wasn't sincere about stomping out sexual misconduct in the Canadian Armed Forces.
Right. Let me move to your colleague. Let me move to your colleague, Ms. Mathyssen. What more do you think needs to be? Are there more questions that need to be answered here, Lindsay Mathyssen?
I think that there are, and I'm certainly awaiting to hear what happens at Defense Committee. I think what's clear. Ms. Vandenbeld said specifically that proper processes have been followed, except that I think that there were processes in place, but they aren't proper. And they certainly haven't provided the supports that these women who have come forward need. They haven't gotten to a point where women feel comfortable, safe, and can serve equally in the armed forces. And that's where we need to get to. I'm really happy that in our committee, we are getting to a point where we can put a report forward, where we can hopefully start to see some answers, some actions that the armed forces can bring forward.
But do you think? Do you think there are still, based on this latest testimony, do you think the Defense Committee needs to have more hearings?
I think so. I mean, their study was specifically to figure out what went wrong at the top,
right.
And this is one of the things that went wrong at the top to ensure that these women did not get justice.
So, Anita Vandenbeld, are Liberals prepared to extend the committee hearings to hear from Katie Telford and maybe others?
So our next study is actually on military justice. And you're going to Ms. Matthyssen's point, the processes failed in this case, and we need to look at that. One of the key ones is the military justice system, and the fact that we need to make it that women can feel that not only can they come forward, but they will see justice done.
Oh, okay. So what are you prepared to have Katie Telford come before the Defense Committee and have another hearing, at least with her?
I believe that Mr. Marquez was very, very clear. I think that we know exactly what happened. We know that there was not enough information to continue at that time. We did exactly the same as what Mr. O'Toole
did. Okay, so that's a no.
About allegations.
So that's a no. Is that a no then? You think the hearings have done their work and you don't need to hear from anybody else? All right, Mr. Bezan, there's your answer. Liberals don't want this to proceed.
Of course they don't, because this is getting very close to the top. And when you got the second in command to the Prime Minister being his chief of staff in the loop and in the know, we know that she has to explain to the Prime Minister at some point in time about what the nature of these sexual misconduct allegations were, and must have also raised the issue that
it's not clear anybody at the time knew what the nature of the allegations were. The complainant didn't want to proceed, didn't want her name known.
As Elder Marquez said, when he was told by Katie Telford to look into it, he assumed the worst. And we don't know what Zita Estravis said to Katie Telford, or if Katie Telford had a conversation with Mr. Sajan.
For the record, that was Mr. Sajan's chief of staff. Yeah. Okay, look, let me jump ahead a little bit. Lindsay Mathyssen, we now have the government talking about creating this this top-level job in the military to oversee racism, sexual misconduct, but it's going to be within the chain of command at the military. Is that going to work?
I don't think so. I would hope so. But from everything that we heard in terms of the testimony from Status of Women, you truly need someone who is independent. And all of these organizations, including CFNIS, the Provost Marshal, they consistently said, we are independent. But they are not. They are within that chain of command. And we were repeatedly seen from victim testimony that they haven't gotten the answers that they need. And on top of all of this, I mean, everything that's been said already, they've had so many meetings, so many things come forward, so many people come forward, and yet no one has taken responsibility. No one has taken responsibility for what has happened to women. So
just very quickly, Anita Vandenbeld, there's this creation of this new cultural czar that's going to look at the culture, but people are saying already if it's within the if it's within DND, it's not going to work.
Nobody has said that it's going to be within the chain of command. I just want to be very clear on that. We are listening to survivors. We just put $236 million in the budget for military sexual trauma and for survivors. And we are listening. We will make sure that this is something that will be independent, that it is something that is going to allow for real justice and just outcomes.
Just a few seconds left, Bezan. If it is within the chain of command, if it's within DND, can it work?
Well, the only ones that are saying that can work within DND are Liberals. Everybody else said that it has to be independent of the chain of command. We support that independence. And at the end of the day, we need to see some ministerial accountability here. Minister Sajan hasn't even apologized yet. And we know that Prime Minister Trudeau knew what was happening, and he has to own up to that as well.
We're going to leave it there. Thank you all for your time tonight. I appreciate it. We'll have a chance to follow up another time. Thank you all.
Thanks, Peter.
Thank you.
Canadians are disappointed by the budget, and we're certainly very disappointed by the budget. Lots of debt on the shoulders of our children and grandchildren. Definitely a Liberal plan to raise taxes, and no real strategic approach to job creation. A number of little Band-Aid solutions. So we're in the process of also proposing some of our amendments, some of our own policies, but we will not be supporting a budget that really puts at risk our future. With the risk of interest rates in the next few years, Mr. Trudeau is putting our future prosperity at great risk.
All right, well, notwithstanding the objections of some in the opposition, the federal budget passed this evening. No big surprise there. Let's bring in our panel of parliamentary journalists, and let's start out talking about that. Susan Delacourt's a columnist with the Toronto Star. Joël-Denis Bellavance is the parliamentary bureau chief for Presse. John Ivison's a columnist for the National Post and parliamentary bureau chief for Post Media. Good to see you all again. Susan, the budget's passed as expected, so no snap election. Which federal leader do you think is most relieved about that?
Well, I wanted to say Justin Trudeau because it's his budget, or Chrystia Freeland, but I would imagine, I think it's Aaron O'Toole. I think despite the fact that he did rush an environmental plan out the door, his team does not seem absolutely ready, or just not ready, to quote another ad from another time. I think Mr. O'Toole would benefit from a summer of a little getting out and talking to conservatives, because it doesn't seem like they're all moving as one right now.
All right, Joel. So go ahead, finish, Susan.
No, that's all.
All right, JD, what do you think?
I would opt with the same leader. Aaron O'Toole must be the one who's more relieved that the budget is finally passed and that there's no snap election, because he would have suffered maybe more damage if there was a spring election. Now, as Susan mentioned, he needs some time to be able to pick up his groove. And maybe with the vaccination campaign going better in parts of the country, he may start a barbecue season this summer and try to meet and greet Canadians. So I think he's the one who's most happy that this budget is now behind everybody.
All right, a low-emission barbecue season. John, what do you think?
This is the shortfall of coming third, because I was going to say the same thing, but I agree with my colleague.
Let's pretend you're coming first.
Aaron O'Toole will be relieved. I would say that Justin Trudeau, though, will be relieved at the reception the budget has got, notwithstanding critics like myself who thought it was a pretty cynical vote-buying exercise. But there was a Leger poll which Post Media ran that suggested 15% of New Democrats would be more likely to vote Liberal. And it doesn't sound that much, but probably represents about 500,000 votes if it were extrapolated. So if he could get those 500,000 votes from the NDP, I think he will be very happy with the way things have gone.
All right, let's move on to the pandemic response, which is chiefly the reason nobody said they wanted an election now is or some people did say they wanted to focus on this. Susan, Ontario is now is going to be getting more help from the military and from the Red Cross. Cases have been raging for weeks in that province, and the request is coming in now. Okay, we've lost Susan, but let me jump to JD and we'll get back to Susan. So JD, what do you think about the time it's taken for Ontario to ask for this help and to get it?
Well, it just shows that the government is still in chaos mode, if I may say, responding to what's happening instead of anticipating events. And that shows that the situation is getting more dire in Ontario compared to other provinces. In Quebec, the number of cases has not gone down under 1,000, about 889 cases today, whereas in Ontario it remains high at about 3,500. So the provinces maybe should have asked for help because earlier, just to accelerate the vaccination campaign, because right now Ontario is really alone in where the situation is really getting out of control.
John, what are your thoughts on this and the request coming when it does from Ontario for help from the military again?
Well, I thought there was some good news today that the R number, the number of people who are infected per individual case, seems to be below 1 for the first time. That suggests that perhaps we've peaked. And I think that could not have come at a better time for Ontario, because obviously things are pretty dire. And when you see very sad cases like the 13-year-old girl who died in Brampton, it suggests that these new variants are really grabbing hold in a way that we haven't seen. So let's hope that the peak has been reached and that help is coming just in time.
Susan, help. We've got Susan back now. Help's coming from the military in Ontario and from the Red Cross. And I'm wondering what you think about the timing of the request and the dynamics we've seen the last couple of weeks when the federal government first said, look, we're ready to help with anything you need. And Doug Ford said, just send me more vaccines. I don't need any other help than that right now. So things are changing in Ontario. And what do you make of the timing of this?
Well, I think it's probably, as you allude to there, coming a little later than we had expected. I think I, as an Ontarian, lifelong Ontarian, can't help but see it through the long lens of history, too. You know, in the long lens of things, Ontario is right now a have-not province. You know, Newfoundland was always the have-not, and the picture of this, of Newfoundland, mighty Newfoundland sending 9 people to Ontario today, really does, it almost turns the Federation upside down and shows just what a brutal third wave this is. I think the death of the 13-year-old girl, too, is a moment. I think this is a day in which we really see how much this has unsettled Ontario and sort of turned it upside down. But we knew that that the federal government has been meeting since last weekend about what they could do for Ontario. Ontario didn't flick the official asking switch until today, which people are going to ask some questions about too. But I do think the situation is almost so dire there that I don't know that this is the time to say who should have done what first. It's just been a bad couple of weeks in Ontario.
John, let's broaden that conversation too to the rest of the pandemic response. Principally, let's focus a bit on the borders. Erin O'Toole today calling for the cancellation of all international flights, not just the flights from India and Pakistan, which has been done, but we have people taking flights to the border and then taking taxis across into Canada. People paying the fines and skipping the mandatory hotel quarantine. Do we have a coherent border policy right now, John?
Well, I don't think we do. I think it was interesting. Bill Blair tweeted out at the weekend that the government has prohibited non-essential travel for the last year and that international travel is only less than 2% of all cases. Now, if you actually go to the Public Health Agency website, they admit that really underestimates the number of travel-related cases because it only applies to those that are directly on a flight, not any community transmission subsequently. It doesn't apply to any land or sea travellers. Suffice it to say, I think that Blair was trying to deflect criticism that Doug Ford had raised that these new variants didn't swim here. So we've got a bit of a spat going on. Obviously, O'Toole is piling in as well because he sees this as a bit of a vulnerable heel for the Liberals, and the Liberals are already playing defence on it. But I think it is behooving on O'Toole to acknowledge the fact that if you do shut down everything, there's a price to pay for that. Yeah. And I think this is a discussion we need to have before the next thing rolls around. Is that we can close everything, and at the moment, frankly, I'm in favour of closing everything, including interprovincial flights. It seems ridiculous to me that we've got a P1 variant in Vancouver, primarily based in British Columbia, and you can get 7 flights a day out of Vancouver into Ontario. Clearly, that's going to result in that P1 variant spreading.
Right. Quick answer from your Joël-Denis and then Susan. Do we need more done at the border?
Well, we could always do more, but there's a problem the government has to deal with. If you suspend all flights from abroad, you will probably affect the supply chain because a lot of the cargo comes with passenger commercial flights. So that's a dilemma that the government has to wrestle with. And so far, that's why you've seen maybe some flights still bringing some passengers. And for them, the best option is to impose quarantine in the hotels and then 14 days later at home. But it's a dilemma because the supply chain has already been affected. And if you impose more restrictions, the supply chain will also be more affected.
Susan, do we need to do more? Are we doing the right things? Or is there still work to be done on securing the border and trying to keep these variants out?
Yeah, I think it's clear that, these are coming from other places. The problem is there's a moral one. You don't want to feed xenophobia. There's a logistical one. You don't want to affect the supply chain. And also people are cranky about these travel requirements. That it's not just the governments that are resisting, it is the public. that is resisting these travel requirements. So, with every story of a stopped flight, there comes stories of tragedy and people not being able to get abroad. So it's not as simple as it sounds, but I think we should do more.
All right. Thank you all for your time. Take care, and we'll talk again soon.
Thanks, Peter.
Thank you, Peter.
That's all the time we have for this edition of Primetime Politics. From all of us here at CPAC, thanks for watching.